Hello, everyone, and welcome to another episode of Common Sense with Dr. Ben Carson. I'm your host, Ben Carson. And today we have a very special guest. We've had a few physicians on and even a couple of neurosurgeons, but we have an amazing person today, Dr. Theodore Schwartz, one of the nation's leading neurological surgeons. He specializes in brain tumors and epilepsy surgery. He's an attending neurosurgeon, an endowed professor, I believe the first endowed professor of neurosurgery at Weill Cornell, which is quite a major accomplishment. Director of epilepsy surgery and the imaging laboratory, director of anterior skull-base and pituitary surgery, co-director, surgical neuro-oncology. You name it, he does it. He's been listed as one of New York's super doctors, best doctors in New York magazine, America's top surgeons. The list goes on and on, multiple awards, lots of media presentations, and has written hundreds of scientific journals, has a major laboratory effort going on, and now has written a book. And we're going to talk about that. But Ted, let me just ask you, first of all, thanks for coming on the show.
Ben, thanks for having me. Honestly, before we begin, I just want to tell you a quick story about you and your impact. Your book came out, I look back now, Gifted Hands, in 1990. I was a second-year medical student trying to figure out what to do with my life. And I probably maybe read it during my rotations and when I was choosing what to do. And I was reading neurosurgical books literally while I was, taking other rotations. And that book so affected me and so helped me make the decision that I made to do what I do for a living, which, as you know, is one of the most incredible jobs that a human being can do. And one of the reasons I wrote the book, honestly, one little reason, was to try to inspire other people like you inspired me. So I just want to thank you for that.
Oh, well, thank you so much. I really appreciate that. And, I was excited to be able to talk to you, just knowing what your background is and what your incredible accomplishments are. And we're going to talk a little bit about gray matters. But before getting into that, when I went off to medical school, I was pretty sure I was going to be a psychiatrist. Nothing else really interested me. I hated the sight of blood, so I certainly wasn't going to go into surgery. But I never did get to the place where I like to see blood. But I always say to people, would you rather have a surgeon who likes the sight of blood?
That's true.
But what was it that attracted you to neurosurgery?
I'm the son of a psychoanalyst, so I also thought about psychiatry, and I was always very interested in the mind and the brain, and majored in philosophy when I was in college, and wanted to figure out how the brain worked and how memory worked. But I found during my rotations, I'll never forget when you first see a human being operating on the human brain, and you see the brain exposed. And you see them working under their microscope for hours on end. To me, it was just an awe-inspiring sight. I couldn't imagine that a human being would have the understanding, but also sort of the ability to go into a human brain, manipulate it, to try to make someone better, to understand it that well. And when I first saw the human brain, it was like an epiphany for me. I remember feeling like at that moment, I couldn't imagine doing anything else. Once I realized I had the opportunity, all I had to do was say, hey, this is what I want to do and devote my life to. There was no other specialty. And as you know, most people, when you say to someone, I'm thinking about neurosurgery, the first response you get from most people is, if there's anything else you can do with your life, you should do that. Because it is such a huge commitment and such a huge sacrifice. And the truth is, I felt like there was nothing else I could possibly do once I saw it. So I didn't have much of a choice.
Well, it's interesting because I had that awe when I saw the brain too. And, I never got over that. Even many years into it, when I see the brain, I'm thinking, this is what makes this person who they are. Yeah. Some people concentrate on skin color or hair texture. Those are superficial things that have nothing to do with who you are. It's the brain that has everything to do with who you are.
No
And
doubt, no doubt.
we come to realize that. But you've done a lot of pioneering work, lecturing all over the world, extremely well known. How does this book differ from some of those other efforts?
Well, writing a book, as you know, for lay people is quite different than writing a scientific article or giving a lecture to neurosurgeons about how to do a new technique. You really have to access a different part of your brain, a humanity, an emotional part, to try to see what you do through other people's eyes. And one of the experiences that I so enjoy in my career is over the summer, I'll get students who come into the operating room and shadow me. And they shadow me in the operating room, they shadow me in the clinic. And I see what I do through their eyes. And I see the amazement they have at how we can touch people on a daily basis. And so I really wanted to try to take this book and provide that experience for everybody. I wanted everybody to essentially shadow me, through what I do, whether it's in the operating room or getting a phone call on the weekend for a kid with a concussion and what I'm thinking about, or watching the news about when a bullet passes by Trump's head, what am I thinking about as a neurosurgeon when that happens with respect to other assassinations that have occurred throughout history? When I'm under the operating microscope and I'm deciding, how far do I push it? Do I take out that last bit of tumor that may cause a stroke or a hemorrhage? What am I thinking about? What's going through my head? So I wanted to provide the world with that experience and see the world through our eyes, through our neurosurgical lens, and try to come at it through multiple different perspectives.
And I have to compliment you on the way that you wrote that book. I mean, you wrote it in a way that's actually understandable to normal people. And that frequently is very hard for somebody with your kind of technical expertise.
Yeah, that was the goal. And, it's an intimidating book in a way, a book about brain surgery, that's kind of thick. Most people would think, I'm never going to get through that. And a lot of my friends said that. I'd say, I wrote a book. They're like, great. Like, we won't understand a word of it. And I said, no, you don't understand. This is meant for you. And I've had such an overwhelmingly positive response from people I know who are like, wow, we had no idea this was going to be so understandable. I couldn't put it down.
Well, throughout your career, you've seen a lot of revolutionary changes. Neurosurgery is changing itself a lot. I remember when I was a medical student many, many decades ago, we were so excited at the end of rounds because we would get to see the CAT scans. CAT scans were brand new at that time. I mean, if you saw one of those CAT scans today, you'd think it was a Rorschach test, but things have improved so much. What are some of the things that you've seen over the last decade or so that really have been impressive and made a difference?
Yeah, I mean, you make a great point. And I write about in the book, how neurosurgeons were making decisions based on angiograms or ventriculograms years ago, which are these tests that we do where we just, inject air into the brain and do an X-ray, or inject, some dye into the blood vessels and do an X-ray, to now when we get these high resolution MRI scans that really show you exquisite detail and how much that's helped us. And, we used to have, when we got a new consult at 2 a.m, we had to drive into the hospital to look at the scans, and now we can look at them on our phones, at home, in bed. Or it just makes our lives so much easier. We can make our decisions so much quicker. But some of the most amazing innovations in neurosurgery right now have to do with robotics and electronics, as people would think, and computers. You did epilepsy surgery, your hemispherectomy operation years ago. I also do epilepsy surgery in addition to brain tumor operations. And now we place electrodes in the brain using a robot, that basically moves around on an arm. And we just make a tiny hole in the brain and put multiple thin electrodes in instead of making big openings in the skull like we used to do. And like I was trained. And the same is true of brain-computer interfaces. I mean, we're hearing so much about Elon Musk's work now with the Neuralink device that he's doing that's going to allow human beings to basically think ideas that will be put into computers and to control computers with their thoughts alone, which is really remarkable that we're at that stage in human evolution. But that's been going on since the 1960s. And I tell the story of all the neurosurgical pioneers who started putting electrodes in the brain, and the concept of linking a brain with a computer goes back a long way. And neurosurgeons are really the gatekeepers for that technology, because we're the ones who are going to be putting them in and are also very involved in doing a lot of the experimentation. So at the end of the book, I really talk about that as sort of the culmination of where neurosurgery is, which in only 120 years evolved from Harvey Cushing, who, as you know, in 1905, when he started doing brain surgery, the mortality rate was 50%. Half the patients he operated on would die. And now here we are, putting computers in the brain. So that's the story I wanted to tell.
Well, do you think there are any moral issues that we need to consider when we're talking about the kind of things like Neuralink?
Yeah, unquestionably. And I use the word, we talk about opening up Pandora's box, and I use the metaphor of opening up Pandora's skull, because, what we can do is going to be incredible. We have the ability now to put electrodes in people's brains that can really alter their emotions, what they're feeling on a moment to moment basis. We can create joy. We can create sadness. We can dull the brain, create brain fog. We'll be able to enhance intelligence. But obviously, just because we can do something doesn't mean we should do something.
Right.
And I write a lot about the frontal lobotomy, right? The age in the 1950s when we did something we should not have done before we fully understood it. And there were really no ethical constraints that held neurosurgeons and psychiatrists back. It actually was mostly psychiatrists. But now we're living in a different era, right? And so most studies that are done under IRBs with guidelines and committees that are reviewing the experiments that are done to make sure that we protect our patients first and foremost. But who we use these devices on and how we use them is going to be a critically important question going forward. And the hope is that it will be done responsibly and thoughtfully. But I think if we have neurosurgeons involved in that decision making, that will happen.
Well, I think your book really outlines that dilemma very well, and I really recommend people who are interested in the future of mankind. This really gives you a good gateway into it. Can you just talk a little bit, Ted, about CTE? It was a really big topic a few years ago, and it's still a big issue. People just don't talk about it that much anymore.
Yeah. So I traced the history of CTE because the story I wanted to tell there initially was the fact that the whole story of CTE really played out on the pages of our journals, which most people don't know. Most people have seen the movie with Will Smith, and a great movie about Bennett Omalu, who the pathologist who first discovered it. But all the papers that first described CTE and the NFL's publications, where they tried to defend the practice of football, they actually published a series of articles saying that concussions were not a big deal in the NFL, and they tried to present them as if they were science, but they were poorly done and poorly written. And the neurosurgical reviewers who reviewed those papers written by the NFL basically tore them to shreds and said, this is nonsense. And then Omalu started to publish his paper. So I try to tell the story from the perspective of, the neurosurgical journals and the articles that were written. Excuse me. But the take-home message is that we now know for sure that multiple blows to the head can lead to a chronic, debilitating neurological illness called CTE. It existed and was first described in boxers in the 1970s, and we certainly know a lot of boxers, Muhammad Ali being one of them, who developed a Parkinsonian-like disease. And it's a related disease. Obviously, I think in boxers it tends to be more movement disorder related, and in football players it tends to be more emotional and psychological. And the other thing, though, that I try to bring in is that now that we know that CTE exists, and football players are making the decision to play football on a professional level and getting compensated handsomely, I think that's okay, right? Because there are a lot of professions that people do. Whether you're a window washer or you're an airline pilot, you take a certain amount of risk in your job. You're taking risk, and you get paid to take a certain amount of risk. And I think at this point, now that we know the football players are aware of the risk of playing football, and it's their decision to play, they should have the free reign to decide, you know what, I want to take the risk because I'm going to make a lot of money. I love playing this sport. This is going to change the trajectory of me and my family for generations. And we shouldn't be telling them, no, you can't play. It's too risky. We can certainly pull them out of games if we think they're going to hurt themselves and give them the information. But ultimately, it's their choice. It's their choice to play. And I think there's nothing wrong with that as long as it's an educated decision. So our role is to educate, the football players and the public and say, hey, these are the risks. And if you want to take the risk, well, that's fine.
But Ted, I wanted to ask you, a lot of times people go to see a neurosurgeon and then they go for a second opinion and then they go for a third opinion. They just can't quite settle. How do you decide on the best surgical approach? Because you've been given some significant awards just because of your innovative approaches.
So I entered neurosurgery at a time where skull-based surgery was blossoming as a field where you would really dismantle the whole side of the head to get to the base of the skull. So what that means is the hardest part for us to get to as surgeons is underneath the skull. You can imagine, you don't have to be a brain surgeon to figure out, if I want to get to a tumor here, I open up here and I get there. But how do I get to a tumor that's underneath the brain? And so the way I was trained to do it, and I'm sure you also were, your career mostly played out during the period of time where we would open up the side of the head and the back and flip everything forward and come around the brain and under the brain and drill off an enormous amount of bone. And I was lucky enough to start my career at a moment in time where the concept of minimally invasive skull-based surgery and brain surgery came to fruition. And that basically means instead of opening up the side of the head, you can come in through the nostrils and use an endoscope, a long thin telescope, not make any incisions whatsoever, or make a little incision in the eyebrow or a little incision in the eyelid and actually work around the orbit. So it was very challenging to adopt new approaches that are different than the way you learned how to do something from your teachers, because we all admire and respect our teachers. They're the ones who mentor us and teach us how to do brain surgery. And adopting those new surgical techniques that were less invasive really took a change in philosophy and the ability to appreciate that I could do something better for my patients. So when I see a patient in the office, I look at where their tumor is, and I think about all the different approaches I could possibly do to take out that tumor. And I say, what's the least invasive way I can get in there that will accomplish the goal? Because you don't want to diminish the goal you're trying to accomplish and just take a little piece of a tumor because you're using a special approach. You want to take the whole tumor out if you can. And because I've been able to collaborate with other surgeons, nose surgeons, eye surgeons, use their expertise to help me more comfortable work around those parts of the body, I've been able to help move the field forward to move us into those new approaches. But it does take a little bit of, emotional confidence and effort to convince people to let you do these approaches that are less invasive when they're getting opinions from other surgeons that say, hey, I wouldn't do it that way. Like, I don't think it can be done that way. I've never seen it done that way. And that's really the challenge of moving a field like neurosurgery forward, is that you're trying something that very few other people know how to do or can do. I learned how to take out tumors through the nose in Italy. I learned how to take out tumors through the eyelid in South Korea. So I knew that there were other neurosurgeons doing it. I'd seen them do it. I made the trips to those countries. I learned from the experts and I brought it back to the United States, which also just shows you have to keep your eyes open to new opportunities and experiences and ways of do things, and not be too set in your ways, and not think that, the way we do it is really the best way to do it, but sort of look around and see what other people are doing, what other fields are doing. And what's been so emotionally satisfying for me is now to see that a lot of these minimally invasive approaches are proliferating around America and around the world, and more people are doing it, and it's becoming the standard of care. And I was just a little part of that. There was obviously, I'm not the only one. There's many of us who did those things. And it was very gratifying to play that role in moving the field forward.
Yeah, I mean, I would second what you just said very much so. After my neurosurgical training at Hopkins, I spent a year in Australia. And their approach for a lot of things was so different. And to be able to integrate that with what I knew already made a big difference when I came back and started doing some rather novel things. I wouldn't have done those if I hadn't gone to Australia and looked at the way that they did things and started integrating that into my thinking pattern. So,
yeah, and there's a long tradition, Cushing and Penfield and so many of our forebears in neurosurgery traveled to Europe before they came back to the US just to see how everybody else was doing what they did. And it was so valuable to their careers.
well, what advice would you give to a young person who's considering a career in neurosurgery?
So I would say don't be intimidated by the workload. Don't be intimidated by the concept of maybe I don't have what it takes to do it. I don't think you need to be brilliant. One of the things I talk about is the myth of the neurosurgeon, right? The it's not brain surgery myth that we all think it's so incredibly complicated. And I say, look, what's hard about neurosurgery is not the intellectual horsepower. It's the emotional, psychological, physical horsepower, the stamina, the stick-to-itiveness, the grit, and that you don't have to be so brilliant to do. And so I would say if you have a passion for taking care of people, and it really is a caring profession, right? Where at the bottom line, we're just taking care of other people, and you have to have that, and you have to want to work really hard, and you have to be willing to sacrifice some of your personal life to do it. But the rewards are enormous, and they're completely worth it. And I think that's what the hard thing was for me to overcome. And I'm sure a lot of young people, I loved music. I was a musician and I was going to give up all of my music. And I loved, reading and going to the movies. And I thought, oh my goodness, I'm giving up all the things that I love to do. But the truth is you get filled up with so much by taking on a career like this that I would strongly encourage them, if it's what they want to do it.
And what instrument did you play?
I was a bass player, bass guitar.
Oh, is that right? Okay. I was a baritone player.
Oh, really? Baritone saxophone or?
The euphonium.
Oh, wow. Very
And
cool.
actually won a scholarship to Interlochen. I was, but my band teacher said, Benny, you're going to be a great doctor, and I don't want you to get distracted by this music. So don't take.
There's a lot of overlap, as you know, between people who played instruments and become doctors, because it's that same focus of practicing with your hands, and I think musicians become great surgeons.
Absolutely. And when I was at Hopkins, when the residents came and did pediatric neurosurgery, they knew they were also going to learn classical music.
I quiz all the residents in the operating room. I'm like, all right, who wrote this song? Who's the bass player? They never know who the bass player is. Right. They don't know. So I have to teach them that.
How have you achieved work-life balance? I mean, you have children. What do you do? How do you deal with that?
I have 4 children. So I make my family a big priority. But they all know that my neurosurgical responsibilities will trump anything at the moment when they arrive. One thing I did when my kids were little was I brought them all into the operating room. Like on a Saturday night, if I got called in to evacuate a blood clot, I would grab one of them and say, hey, come with me. I want you to see this. And they would sit in the corner and watch, because I wanted them to know what dad was doing when he was missing, a soccer game or a football game or whatever it was, and for them to appreciate that. And I've brought them multiple times into the operating room. And I don't think any of them are going to become doctors or neurosurgeons, but they really appreciate what I do. I didn't want it to be a mystery. The other thing is, you have to figure out what's important to you and what you love doing. And I realized early on that I really loved operating. I loved writing. I loved doing research. But I didn't love all the administrative work. And so I sort of did a little less of the administrative stuff in order to free up more time for my family. And so, I was very much present for my kids. And if you make anything a priority, you will be there. And so they know that. They know that, but it's very challenging. I won't lie. It's hard. Luckily, I married a woman who doesn't put our children above her career. So I always knew that she was available to take care of them. And that was hugely helpful for me to free me up to be able to work as hard as I do and know that everything was fine on the home front.
I would second that one also. No question about that. You've done a lot of exciting research. What is really grabbing your attention right now?
So right now, we are working. Most of my research is in epilepsy, and we have these very interesting models of epilepsy where we can literally take a video movie of every neuron in a mouse's brain and watch as epileptic seizures spread through the brain. And we're now able to intervene in the pathways of spread using chemicals or using light to alter how neurons fire. And so our understanding of how seizures occur in the brain, how they spread through the brain, is really advancing very rapidly. and our ability to alter epilepsy and control it with implants that may involve shining light on the brain or even ultrasound to activate certain neurons and deactivate them is really, really exciting. One of the things I read about in the book that I think is an amazing innovation in neurosurgery is focused ultrasound, which is the ability to non-invasively basically open up the barrier between the bloodstream and the brain. So there's a lot of drugs we give people to treat brain diseases that can't get into the brain because the brain protects itself. And now we have the ability to use this focused ultrasound, which is basically shooting just sound waves through the skull, lots of different sound waves from different directions that focus on an area, open up that barrier. And now any drug that you give a patient as a pill or an IV can now enter into the brain in that specific location to treat a disease. And I think that's going to be a very powerful technique going forward, whether it's for chemotherapy or immunotherapy, any therapy you want to give. I think it's going to be incredible.
Amazing. Well, before we go, I want to ask you a question that's a little bit political in nature. But as you know, the human brain begins to develop very rapidly right at conception. Millions of neurons a day, billions of neurons later on. And it doesn't finish developing until your mid to late 20s. Is it something that you've ever thought about, that we're asking, in some cases, little children who have incompletely developed brains to make major decisions about their gender?
I haven't thought a lot about it. I think that human life is a miracle from whatever perspective you come at it. I think that human decision making changes over time. I would also say that as you get older and older, think about the adult brain. We lose a lot of neurons. We're losing 50,000 neurons every day. And there's a moment in time at some point where we're making decisions as adults where we maybe would be making a different decision if we had more neurons, and our brains degenerate over time. So rather than specifically answer your question, I apologize for not being specific. I think that the brain changes dramatically over our lifetimes. And I think we like to think about our identity as something that's fixed, but I do think it's something that fluctuates over time as our brains change and our experience changes. And I think the more we learn about the brain and the more we learn about how our identities can be altered by the neurons in our brain, I think those things should feed into political decisions. Mm-hmm. How that will happen, I'm going to leave to the politicians. And stay a little vanilla on my answer to you, Ben. I hope you don't hold me accountable for that. But I do think that neuroscience and the understanding of the brain should play a bigger role in politics. Should presidents be cognitively tested periodically to make sure that they have the wherewithal to do the job? Are airline pilots tested? Should neurosurgeons be tested? There's things later in life that also are important, as are earlier in life. So I think all of those issues play together, and we don't really consider the neurobiology of the brain in public policy. And I think we will do that more and more going forward.
Well, that was the other question I was going to ask you. Is it reasonable to ask that cognitive testing be done on people with very important jobs that affect the lives of lots of other people?
I think it is. Look, we've all gotten on a airplane, and we want to know that airline pilot didn't just take a shot of whiskey, or that airline pilot isn't in the early onset of dementia. Actually, I'm going to tell you a story. I once operated on an airline pilot who had a glioblastoma in his left parietal lobe. And I said, "How did you know you had a glioblastoma?" And he said, "Well, I got on the flight and I started flying from Japan, and I couldn't read any of the numbers on the dashboard. And so I asked my co-pilot to take off. And then when we were landing, I couldn't tell. They said I need to go left, and I went right. And I asked the co-pilot to land the plane, right? And he had something called a Gerstmann syndrome, where he couldn't read numbers and he couldn't tell left from right. Now, can you imagine an airline pilot flying a plane? And then what he said to me is, I thought I hadn't gotten enough sleep, So I flew on the next. He got back on the plane and flew again at that moment in time. So should he have been tested beforehand and grounded before that happened? Absolutely. And the same is true of leaders and politicians, neurosurgeons. The question is, what's the right test to do? It's not too stringent. It's not too lenient.
Right.
Who's going to make those decisions? We have to approve those tests. That gets a little more complicated.
But at least it's time to start having that conversation.
Absolutely. Absolutely.
And the last question, you've received a lot of awards. Which one is most meaningful to you?
The one that pops out, I was the Vanwagon lecturer at University of Rochester. And that meant a lot to me because I had been a Vanwagon fellow when I was a resident, which allowed me to get money to do research abroad. And we talked about the importance of doing research abroad.
Right.
And Vanwagon was a neurosurgeon who first split the brain in half and was really a pioneer in neurosurgery. And so his story also led to, I write a lot about the split brain experiments that were done that allow us to know what the left brain and the right brain side of the brain do and give us a sense of what the self is and our identity. So this gentleman, William Vanwagon, a neurosurgeon, has sort of influenced my life at many, many different stages. And so I sort of feel a kinship with him.
I thought you might pick that one. That was good. Well, Ted, I want to thank you so much for being on the show. I want to thank you for writing this book. I mean, this is really quite a landmark book because it takes so many of the things that people sometimes hear about and it interprets them in a way that they can understand. And I think that's useful for all of us. And just thanks for being a great contributor to the health of so many people and an inspiration for young people all over the world. And thanks.
Ben, thank you so much for having me on your show. As I mentioned, you were always an inspiration to me in so many ways, and I just hope you continue doing what you're doing.
Well, I hope you all enjoyed that wonderful conversation with Dr. Professor Theodore Schwartz, one of the real pioneers and movers and shakers in the field of neurosurgery today. And I want you to think about some of the things that he said about the future of neurosurgery and our understanding of the human brain and such important issues as should we, in fact, be doing cognitive tests as people age who have very responsible positions, knowing that there is some natural deterioration, that they do lose neurons as time goes on. How should we react to that kind of information? And that's our program for this week. I want you to make sure that you listen to the last podcast, multiple podcasts, over 100 of them now. Share them with others. Apple, rate us, review us, tell other people about us. And remember, the show is called Common Sense. And that's what we've got to bring back. And remember the cornerstone principles: faith, life, community, and liberty. See you next week.